anyways, I'm going to kind of take you on this journey that I've been on, which is really thinking about assessment and kind of thinking about changing it. So the way my classes have traditionally looked, and I'd hazard a guess a lot of you are in the same position. The majority of what I do is I have, well, now I'm drawing on my slides. Oh dear. I have exams. Those are the biggest portion of the grade. And I also have smaller assessments. I have quizzes, some of those invisible bodies, some of those are embedded in mini lecture videos, all that kind of stuff. Some of them are, some of the grade comes from labs. And then sometimes I have something like a mini paper, or we do these sort of pathology discussions that are not, these are all really tiny assignments. The whole goal really is that all these little assignments are preparation for the exam. So having this structure, and if you had this structure, I'd suspect you're in the same position I was in. When you really start to think about it, I started to think exams. This is like the majority of what I'm doing. And when I think about exams, I think they are so stressful. They were stressful for me as a student. They're stressful for my students. They're stressful for me to get finished so the students can take them. And they're stressful for me to get graded in time. So there's a lot of stress associated with them. And when I started kind of zooming out even further into exams, I realized I really hate grading them with the passion of 1,000 suns. And then I said, well, do I need exams? Is this something that needs to happen? And is this like a requirement somewhere? Or can I just get rid of it? And then I really started thinking about when the last exam I had. And the last exam I had was about my first year of grad school. So it tells me that exams are not part of what you need to be a working biologist. All right. This is coupled with teaching during COVID. You're teaching during COVID, and the student stress level is off the charts, right? We all remember March 2020. It was bad. And it's still bad. Student stress level is super high. You have to deal with tons of interruptions, sort of between students being sick, being in quarantine, or even normal interruptions that happen during a year. And when we looked at remote exams, right, what was the big thing about remote exams? We were all concerned about cheating, and how do we get past cheating? In addition to that, there was this need, and part of the need was the need to develop community in a remote way. So to get students to connect. And how do you do that in the stressed out population? And I saw all of this, and I started kind of bringing the two thoughts together. Okay. So when I go to thinking about exams and thinking about my hatred of grading, the one thing I hate more than grading exams is grading makeup exams. They're the worst, right? So, and then when I think about that the students are going to constantly be interrupted, this tells me there's going to be a lot of makeup exams. So this is like my 9th circle of hell in Dante's Inferno. So then we look on the other side and we say, well, the students are really stressed out. Exams are already really stressful. So now we've got stress on stress. And a lot of times really stressed out students will lead to bad habits like cheating. This tells me this is a bad idea and that exams are really not what we should be doing right now. So I started thinking sort of the 3,000 mile high view of what do I want the students to get? What skills do they need? And what am I really trying to get at with my assessments? I'm trying to get at their ability to communicate really complex topics and be able to distill those down. Their ability to think critically about a problem and solve it. Their ability to look at their performance and look at their own understanding and kind of assess whether or not it is where it needs to be. Their ability to take notes. I work a lot with intervention students. So I work with students that may be underperforming a little bit, and a lot of times they don't understand how to take notes and how do I take these ideas coming at me in a class and distill them. And you can couple that with it. Metro State, our classes are typically like 3 hours long. So if you don't take notes, about 20 minutes and you forgot what happened in minute 1. Even if you did, you probably have forgotten, right? And I want my students to be able to link ideas together from different units. And lastly, what is the thing? I haven't done an exam since grad school, but what I have done is a whole lot of peer review. So I wanted to get a peer review component in there as well. So how do I get from sort of the stress, how do I get to this sort of more skills-based assessment? And the first idea that I came up with, and I actually have to give my sister Molly credit for this. So I was talking to Molly and I'm like, what do I do? She is a middle school science teacher and she's like, sketch notes. And I was like, okay, that's really cool. What's a sketch note? And there's a reason that the format of this seminar looks the way it is. I'm trying to get you acquainted with this idea of sketch notes. Sketch notes are just what they sound like. It's sketches, which are visual elements that you're using to show ideas. And the note-taking part is summaries. You're not writing a paper. And what you need to do to make a quality sketch note is you need to take a bunch of sparse ideas, organize them, and link them. So these are things I actually want my students to be able to do, right? I want them to be able to take these big ideas, distill them to their most important concepts, and then link these concepts together. And I want them to like organize the information in their brain so that it's not, I don't want it looking like this. I want the information in their brain to be organized. But what this allows the student to do is it allows them to determine what the story is and how they want to tell it. So the way every student organizes it may be different. And that's okay. You're helping them to create the organization within their own mind. So my before sample workflow, this is exam Cindy, right? And exam Cindy would post an assignment or an exam, the student would do the thing, the student would turn the thing in, and I would assign a grade, and the student would probably never look at this again. Which is, by the way, like the worst thing about grading. So if we use sketch notes, now what we can do is we can change this workflow and we can add in that peer review component. So the student can create the sketch note. They can then have their peers look at it and give them feedback, and then they have to look at it again, already based on that feedback. Okay, so they're already doing the cycle more than they were when you were just kind of giving them a paper in a couple hours. So what this does is it takes this workflow now to this. I post an assignment, my students make a draft, they post the draft, they get feedback from other students, and they use that feedback to revise their draft. And they go through sometimes a couple revision cycles before they turn in their final work. Okay. Part of the sketch note process was figuring out how to convey what I wanted to my students. So we created a rubric. This is what I call the style part of the rubric. And the style part of the rubric is basically, are you organizing ideas in some kind of hierarchy? Are they neat, which tells me that you're organizing? Are you explaining jargon, or are you just like copying what the textbook says? Are you using images to try to reduce the number of words? And by the way, drawing concepts is really hard, but it's a really valuable thing pedagogically. And are you indicating sort of the organization that you have? All right. Then there's like the concept or the content-based parts of the rubric, which far outweigh the style-based point-wise. An example, and a lot of these, I kind of matched them up with my test questions that I've used in the past. So right now we're doing the module on urinary tracts. So you're going to see my urinary rubric. Trace the pathway of urine from where it starts, explain the role of these structures in its creation, explain the role of the different sphincters in your ability to voluntarily urinate, explain the structure of the glomerulus and how that relates to its function. And then we get into, now we get the higher level bloom stuff, right? Give me the constriction or dilation on those arterioles and tell me how that's going to change flow through the glomerulus. And they have to convey this a lot in images. So that makes it really, it's difficult, but that helps it to stick. All right. And then I always have bonus points because it's easy to sometimes mess something up. And a lot of the bonus points are just giving them a different way to convey the same kinds of ideas. So for this one in urinary, we have the effects of caffeine and or alcohol and how this impacts nephron absorption. Because they're going to do the renin-angiotensin pathway, I've got a little thing about ACE inhibitors. And this one also has the reproductive units. So that's why it's got lactation and fetal circulation on there. One thing I want to bring your attention to is down here, there's an on-time bonus. I don't do late penalties anymore. And it's because with COVID and with the student population I serve, which is predominantly working adults, a lot of them are parents, they're dealing with everything we've been dealing with this year, right? The schools are closed, the kids are home, everything is going crazy and you have to be able to shift. So the on-time bonus allows them incentive that if they're 95% of the way there, they're going to turn it in. But if their life goes crazy, they don't have to beg me for forgiveness or feel like they're going to fail. All right, so one of the things that we've done is this peer feedback process, and this is really important. And I do this, by the way, both in anatomy and physiology classes and in biology. The peer feedback process, right now I'm using something called VoiceThread, but you could use any number of different things. And this is about what it looks like. So it's a little slideshow. And in this case, they had 7 units in their end sketch note. So I said post 3 drafts. And then they have to give feedback to 3 people using the rubric. Originally, I scaffolded the questions. That didn't work so well. But if we just say, find your buddy a couple points using the rubric, it works really nicely. And so here's an example of students can write feedback.
This might be an issue unless you made this, but I feel like you might have, I don't know if you made this or not, but I think she doesn't like us to use images, and I think she would count that as an image that you would have to draw. So I would change that. Otherwise, I feel like that was really good. I think maybe go in a little more detail with the second messenger enzyme and the phosphorylation.
What might be nice, to be honest, is to kind of back it up towards what we saw in the FET, where you've got, your mRNA, or you've got your unzipped DNA, and then your transcription factors are binding, and kind of say, hey, negative says no, and positive says yes. And, that would make it a little more obvious what those things are doing. And I think it would take it more toward a drawing and away from like just a statement. In class, we did the lac operon. All right, turns on and off a gene. I love that you've got a light switch in there. That's great.
All right. So this program is called VoiceThread, and it's pretty fantastic. But there are other ways of doing this. So if you're not a VoiceThread campus, you can use Flipgrid. You can use Padlet. There are all kinds of ways to do this. And if you're in person, then you can have the students doing this in person as well. With my anatomy and physiology class, we have review sessions, and during the review sessions, the students are able to bring in their comics and have everybody comment on them. So that's what the feedback process looks like. Then we can go to what the comics look like, and I'm going to show you a bunch of different ones. And one thing I want you to notice is how unique the different comics are. So this student, the way that they organize theirs is they take each of those boxes on the rubric and they make it into its own little card. Whoops. Oh, give me a second. Technical difficulty. Don't pay attention to the woman behind the curtain. There we go. They make each one into its own little card, and then they fit the cards together with different arrows. So this works really well for a student that's just trying to organize these concepts in their head. Okay. Now this student had an iPad and knew how to use it like a rock star. So this one was on, the last one was homeostasis, this one's muscle contraction, and the students were given a bunch of different things that they had to talk about. And this student did just a really beautiful job writing them. I probably, to tell you the honest truth, dinged the student on the amount of text that was in here, but at the same time, you know, I think at the point that they have organized this in the way that they organized it, they have it down. This is from my comparative physiology course. In that course, we do much more comparing different systems together and talking about how those concepts relate. And so they've even got, you know, how does a human relate to a frog, and how do different circulatory systems differ? And then students can even use images that they get from the visible body software. And this is something I make very explicit in the rubric. You may use visible body images for this. So for example, in this one, they needed to look at the flow of blood through the heart. And so the student was able to use that visible body heart and draw the flow of blood. A lot of them choose to hand draw anyways, but I have some students where the creation of the artwork is kind of a roadblock, and that's where I think visible body can be very helpful. And they still have to think about the orientation of the model and how they want to capture the image. So I think that even though they're not doing as much drawing, it still is engaging a lot of the process of how do I best represent this. Alrighty. So what happens with these is that the creation of the rubric takes some time, right? And when I tell people about the comic project, they say, how in the heck do you grade that? That must take forever. And the truth is it actually doesn't, because what I have is I have this beautiful rubric that I made that the students had up front. And when I'm grading, what I'm doing is I'm going through the rubric and I'm saying, okay, you forgot the olfactory nerve. You know, managed to get each of these structures, they're all in there. And so it's a very quick form of grading. And this is what I give back to the students. One thing that I have done in the past is that I have given the students the rubric and then allowed them to revise and resubmit. And so now they know like what parts they're not clear on, and they know where they need to get clarity. But I'm not really, if you look at what I'm doing here, I'm not really giving them the answer, right? I'm saying you've got the fungiform papillae wrong, but I'm not saying exactly what they are. Again, this cuts down on the grading time, because if I'm grading an exam, I always write down like a essay on what they got wrong. Yeah, and these, just as it says in the comments, these rubrics, you can put them straight into your learning management system and just click. Super quick. I'm a little old school, and then I like to paper and pen it so I can write a little more. Okay, so what this moves us to is sort of my next workflow, right? Where I post the assignment, I post the rubric when the assignment is posted. So they have it actually at the beginning of a unit, so several weeks before the final is due. I can post feedback questions, or I can just have them find their friends' points using the rubric. I think the latter works a little bit more organically. And the students turn in their draft. It's better for them if they do it on time, because then they get more feedback from their peers. They revise, and they can turn in their final work. And if I want to, I can allow them to revise and resubmit that final work. And because this is so like unique, you don't really have to worry about cheating as much. I would absolutely be willing to share my rubric. And you're welcome to, we'll share my email at the end of this. And if you want, we can, you know, I can send you rubrics. They're not perfect, but they're, it's always a work in progress, but if you've got something to start with, you can edit. So in talking to the students about this, I've been saying, what has this been like for you? Because I assume they'd think, okay, lady came back from sabbatical and she lost it. All right. And what they say is they say the comics are a little more difficult than a normal exam. But they feel that the peer review and the comic help their ability to understand, to be able to apply their understanding a little bit better. They do note that I catch them more when they don't understand something. It's a little harder to get away with it. They feel that they understand how they're assessed better and that they have a little more agency in that. One thing I'm planning on working with my earlier career students, my Gen Bio students, I'm planning on teaching them how the rubrics are created so that they will understand that for their classes. So the students prefer these to regular exams, despite that they're more work. And they feel that they're getting a lot of skills outside of class. One of the things I hear from the nursing students is they're like, I can explain this stuff now. And they feel really good about that. And a lot of the students have told me, I'm using this note-taking method in my other classes. Now that's all preliminary stuff. I'm working on more assessment-based results, like are the grades better, you know, and the grades in the class are better, but they're allowed to revise stuff. So I'm trying to figure out if the retention is longer. I will say if I run into a student in the hallway and I say, what was in the lower left hand of your first comic, they can tell me. It's really eerie, but they spend a lot of time on these. Okay, so my second, oh, and there's a question in the chat. Yes, I replaced all my exams. I just got rid of them and I'm a joyful grader now. Because when you go through those rubrics, you're like, oh, they forgot it. And it's not, I taught you this 30 times. Why didn't you remember it? It's changed my perspective a little bit. So I also wanted to look at another form of assessment. So that was kind of like the exam thing, but with anatomy and physiology, I felt like the comics could focus on the physiology, but if I have the students just labeling stuff in anatomy, are they really being tested on their anatomy knowledge? And I wasn't completely comfortable that the comics were going to hit that. So I started thinking about lab practicals. And, you know, in the old days, right, we would have a dead thing and we'd walk into a room and it would have pins in it. You'd have to say what the pins were stuck in. And now, you know, sometimes you have like your plastic models you might do that with, or if you're a visible body user, you've got the visible body dissection quizzes, right? So I wanted to take it one step further, because I feel like one of the problems with lab practicals is it's much more identification and you can't get all the way to the function stuff. So I started thinking about my nursing students in particular and what did they need? And they need to be able to explain how the body works and how the anatomy relates to the physiology. So what I did is I decided to have them record videos. And, you know, there's all sorts of software for recording reaction videos now. This is like apparently a big thing. People record themselves reacting to videos that they're watching, which is crazy. But it allows our students to screen record and record their face at the same time. And they can do this while they're using the visible body programs to dissect. So what I did is I gave them a handout and like a video example. This is what it looks like. And it's me doing one, walking through it. A handout, this is how you can do it. Although a lot of times the students know how to do the techie stuff better than I do. And again, they're given a rubric ahead of time. These rubrics look a little bit different. So this is an example of what we used for cardiac cycle and ECG. And you can see I recommended the beating heart and pathophys because I have mad love for that. It is so cool. And I said, okay, you're going to describe the events of the cardiac cycle, when the valves open, state the functions of the heart, these parts of the heart and electrical conduction, and relate the conduction pathway to the mechanical action of the heart. And literally, as I'm watching these, I'm just checking these off. Because of the way that we upload the videos, the students are limited in how long their video can be to about 5 minutes. Sometimes I'll tell them, okay, you can split your video into 2. But the limit is really good because it forces them to practice. So this is an example of one of the videos from one of my students.
So when the atria contract and send blood through the AV valve into the ventricle fills, and then when it's almost full, the atria contract and top it off. And then this AV valve closes so that the blood can't flow backwards, and it goes out to the respective artery in the body. And it starts up here in the SA node. The electrical signal.
Oops. Oh, I didn't mean to skip that. So one of the things that I told the students when we were doing these is I said, you may not.
So when the atria contract.
Hold on, technical problem. I told them that they had to use the draw function or their cursor. They're not allowed to click because I don't want them getting that feedback on what it is. So you kind of caught where that student was like the perspective artery. There is that little brain fart. And that's okay. What the student goes on to do is they go on to draw in the conduction pathway, and then they use that beating heart model, and they show the excitation, and they stop it in the model and talk about exactly what's going on where and what part of the heart is being excited. So, and sometimes what I'll do with these is I'll work in a pathology, and I'll be like, okay, if you had a bundle branch block, how is that going to change the contraction? And then they can work that in there as well. So the students will often do these many times before uploading them. They're practicing again and again. They're practicing that dissection. Usually they're creating a tour invisible body to use so they can move between models. But even that, they have to engage in thinking about what is the best way to convey this. And that's hard, right? And I'm also, in a way, I mean, think about it, I'm putting them in the instructor's shoes. This is what we have to do all the time. And now the students are learning, oh man, now I've got to do all this prep to make a video, and I'm going to figure out how I'm going to say this and how I'm going to make it linear. You can require the students to show their face, so you can have them engaging actively with the camera instead of reading. I haven't used that function, but some of the students choose to. And the students have been really excited about this because they feel like they're getting an interesting skill set. I also like it because I feel like they're making review materials that they can use later. And one of my dream goals, this is like the pipe dream, is that someday we will use this sort of information so that we can create an open educational resource that is completely student created. I think that would be amazing, but that's the pipe dream. So with that, what I wanted to do, I know normally in office hours, kind of tack at you for a while, but I wanted to get in at creating an idea board. What sorts of ideas can we come up with for getting away from the traditional exams and quizzes that we've been using, and how can we modernize it in a way that engages the student's skill set and also engages their brain more? One thing you'll notice, and I'm saying repeatedly, is that the students are practicing. And everything we know about how your brain learns is that it has to revisit the information multiple times to strengthen those connections. And through doing this, the students are strengthening the connections. Okay. All right. So this is where I'm going to throw it out for ideas, discussion. I'm interested in what you think.
So I should say too, if you would rather talk versus putting something in the chat, just raise your hand and I will unmute you.
All right. Well, thank you for the compliment, Travis. I've been really excited about trying to think of different ways to get at student knowledge. And ways to make me more joyful. I do find, like, I feel like these methods, I always had students that were getting C's where it didn't match how I felt they should be doing, and now I feel like their grade matches them. Oh goodness, now I've got a bunch. So yes, advanced students doing oral exams. So this is a way you can do an oral exam with a virtual cadaver. That's pretty sweet, right? And it's okay if the student does it 10 times to get it right. They get it right, right? So I'm asking about any kind of alternative. Thoughts about what I presented here, but also any kind of alternative. I will agree, not all students are tech savvy. So this is why I do have a tutorial for anyone who does need to come up to speed. It hasn't been too bad, and I stick to free apps that they can use. I do not use, there's a question about case studies. I don't typically use a lot of case studies because I find for me, they're too punctuated. They don't really work with my style quite as much. But what I do is I'll bring in a pathology, or I'll bring in, I do comparative physiology. So I'll bring in a comparative thing and I'll be like, okay, let's talk about the giraffe heart and why would it weigh 15 pounds and be this big? And what advantage does that give them? And then what are the disadvantages? So I kind of do that instead, and I'll have them do that in their videos. I do a lot with pathology. So we had cataracts, and they were for the vision one, and they were drawing in the cataracts in the eye and talking about it, though it's going to occlude the light. Yeah, so there's a comment about this being a way to get students working in labs differently. It really is. I mean, one of the reasons I started doing this is our anatomy and physiology course went online. And so I went from having the students in in-person labs to all of a sudden I don't anymore. And I was like, how do I strengthen this skill set and how do I get them there? And this is one of the ways to kind of bridge that gap between the online and the in-person. We do, my classes are actually, I'm lucky, they're pretty small. Anatomy and physiology sometimes goes up to 48 students, but usually I'm about 24. So I've got little classes, which is a delight. And that allows me to do a lot of this, but I don't think that you couldn't do this in a bigger class. So I've been timing myself and how long it takes me to grade these things. And I'd be faster with the Scantron, but I think if you're using anything else, you'd be able to do it. For this, working in a class of 300 to 400 students, what I'd probably do is you could, if you're doing the video part, have the students work together on the video, or you could limit, you can limit the size of the video. What I thought is, I was like, these videos take me, I do one watch through to grade it. I've given my students a max of 5 minutes because I have a lot of English language learners. I don't want them to feel too rushed. And it takes me about 5 minutes to grade a lab report anyway. If I'm honest, it usually takes me longer. So to me, it's actually a little bit faster. But once you get up to a 400 student class, I think that you're probably going to be looking more at putting in a group, maybe having students watch each other's videos, something along those lines, and seeing if they can assess each other. So I think that there are ways to do it. Yes, so we've got a physician's assistance program. So, physician assistant. My students have been correcting me on that. So this is something I've actually talked about with another PA faculty member, and it was, yeah, how do we bring this in and start having the students present clinical cases? And guess what? There's a whole pathology app that you can use. And for PT, you can even use the muscle app, right? And get all those movements in there and then start talking about what movements being created and where are the origins and insertions and all of that stuff. And you can scale that rubric to whatever level you need it to be at. All right. Yeah, there's another person talking about getting rid of the high stakes exams. I would urge it. It has made me so much more joyful. And the students, I never realized how stressed they were from exams. There's something wonderful about taking the stress away. I will say one thing that I had a colleague who I talked to when I was venturing on this process. And I said, I want to have my students do a creative project, but I've never done this. And he's a writing professor. So I was like, okay. And he said, you have to give them time. And so what I've done is I've taken I used to do a review day and then the exam day, and I've taken that and I've turned it into project time. And during project time, they bring in stuff and we just talk. And so we do this through Zoom, and I can put them in breakout rooms. I usually have a room on the side that I call the sidebar. And so they're allowed to sidebar me at any time. And the whole goal is to get them up to speed and make sure that everybody knows, you know, what's going on. Where they do have questions, they're asking those questions. And it's a really fun way to approach this. All right. Medical anatomy and physiology course, and you've hated exams. Yeah, I hate them, right? They're the worst. Yeah, so what you could do with this one is you could have your students maybe pick a pathology that affects the cardiovascular system, right? Or you could be like, pathology affects the heart. And you could have them do that heart dissection and talk about, this is how the heart's normal, how it should work normally. This is how the pathology impacts this. And that's what they're going to have to do anyways when your students are going into their careers, right? They're going to have to explain to people, this is why your heart is not working the way it should be. And this is how it should be working. And this is how we're going to fix it. So I think that you could have a lot of fun with that in the medical anatomy course. And to be honest, it's such a fun, think about all the stuff that's on YouTube now. This is a way to kind of, in my mind, we could enrich space with it. And one thing that you could do in your medical pathology course is if you have the students do these workups, you could have maybe some sort of like, I don't know, differential diagnosis where students are now watching each other's stuff and giving feedback and saying, well, I don't think it's that, I think it's this, and I think this is why. And you could get into some really neat stuff there as well. Oh, excellent. So this is another person that does palpation tests, but they also do video assignments. I think the video assignments have been really fun. And, you know, think about when you're teaching, you're trying to come up with, how am I going to teach this topic? I still remember being in it was an interview ages ago, and they said, you got to explain the ionic basis of the action potential. And I was in my office at home, and there's no whiteboard in here. I had nothing. And I completely failed that part of the interview. But like 2 minutes after I got off the phone, I was like, I know how to do this. And I created a video of me doing it with like a couple ping pong balls, a toilet paper tube, a rubber band, just MacGyvering this explanation. And I think anytime you can do that, it's that ability to relay these simple topics or these complex topics in a simple way and make them really relatable. And I think that that's, to me, one thing we've done with science, right, is we've siloed it into the ivory tower and we exclude so much. And I feel like the more that we bring it to a level where anyone can understand, the more minds we can get involved. Do I allow the students to revise the videos? I haven't been. The truth is the videos have been so darn good, I don't feel like I need to. I did for the first one allow a revision because there were some students that didn't get it. So I kind of was like, okay, you can have a mulligan, you can do it again. But for the most part, the videos, they do not get a chance to revise. This semester is a really busy one for me and the classes are bigger. So this semester we're not doing revise and resubmit, but we are doing peer feedback. Yeah, so this idea, a colleague of mine, there's something in the chat about oral exams. A colleague of mine has been doing oral exams for years and swears by it. And I always thought, how do you grade an oral exam? It seemed so weird to me. And then, you know, you talk to any writing professor and they're like, oh, you read a rubric. And as a biologist, I'd never seen a rubric, let alone written one. So you could totally do this same thing and have the student do it through an oral exam. You could have them Zooming you live and showing you the models, you know, there's a lot to be done there. And yeah, so for animal dissection, I think you could use the peer review cycle. And I think one of the cool things that you could do, this is to Mary, one thing that you might be able to do is maybe have like one student in a group does frog, and one student in the group does fish, and one student in the group does mammal, and one student in the group does avian. And they look at the comics and they figure out like what is the same and what is different. So I've done this before. It's one of my digestion labs. I'm always struggling for really killer digestion labs for comparative phys. And one of the things that I've been doing lately is I give the students cards, and the cards have different animal names on them. And I hand the cards out to the students, and the cards will be like panda, or which panda digestion's crazy. They're a bear, but they don't eat what their digestive system wants them to eat. Students love it. Like panda, caterpillar, all these things. It's be how does your animal digest, and how is its digestive system adapted for that? And the students love it because they start to compare. And we'll say, well, what structure, you know, what is this structure doing? And what's the analog in this system? And we have this, it's just a big, long discussion. It's a blast. All right. Sorry, you guys are prolific with questions. So I'm trying to get to everybody. Says we've got anatomy separate from physiology. Physiology is easy for links, but anatomy is a bit more difficult without the physiology. Ooh, that's true. That's true. So one thing you can do, I mean, it depends how your course is structured, but you could talk about, I could see where you could talk about the different tissue types and their functions. You could talk about, I think that this would be really amenable to joint morphologies and how they move, where you could do, okay, this is what a saddle joint is, and here are where the saddle joints are in your body. The links, sometimes what I do for links, honestly, and I did this the first semester because I'm still trying to figure out how to get it to go, is I left it very open-ended, and I just told the students, you need to link this unit to another unit. And they actually did a pretty good job of it. And it's all the biggies, right? There's like homeostasis, diffusion, surface area volume, structure function, right? That's in everything. So they were able to grab some links, and it was just my tricky way of getting them to remember stuff that they had learned. All right. Part task followed by group work, peer learning, and then individual work for case studies, documentation, and treatment planning. That would be really cool. So you give them a task followed by some sort of group work and then individual case studies based on that. That's a really fun workflow. I like that. And I like it because you're building on, when you add in that peer element, now you're bringing everybody to the same level. Your students that are overachievers are going to get something out of it because they're going to be explaining to the ones that don't know what's going on. And your students that don't know what's going on are going to get help, and they're more likely to ask a peer than they are to ask you. All right. Traditional exams cannot be completely eliminated as they prepare for licensure exams. Yes, but a mixture of traditional and alternative assessments during a course is an excellent way of preparing them for the future. So I do agree with that. And this is a conversation I just had with my dean. He's like, well, you're working with nursing students. They've got to go through licensure. So how does that work? And I didn't have a really good answer for that. And I think, you know, that your comment about, yes, you know, you've got to do a combination is good. To me, I feel like I can see where we could use this sort of method to scaffold going into the licensure exam, and then give them small pieces of the licensure exam so they can kind of, in that way, you're teaching them how to study. All right. But that's a really good question. And I don't have a great answer for it, but I still haven't figured out exactly how to work in the licensure exams. Ooh, so here's Gail. Gail is a PT, and it says, I'd like to ask the students what would this movement look like if this is weak or absent? I can see where your students could show the normal movement, maybe using visible body, and then they could do the movement themselves and be like, well, if it's not there, it's going to be like this. Or I can see where they would do that. And I think that that would be a really fun thing for them. I'm a big fan of any acting tasks. And I will often, when I'm in class, have students get a group of them and be like, okay, each one of you gets a different role. Now you have to act out muscle contraction. And that's what I do with the non-majors. And it's a blast. Are these courses online asynchronous? So this one, my A&P course is all online. I have them synchronous 1 day a week. My bio course is hybrid. So they're asynchronous 1 day a week and then in person or online 1 day of the week. And then I've got another one that's fully asynchronous. And we're using that VoiceThread feedback that I showed you earlier. And the students love the VoiceThread feedback cycle. And even though they're asynchronous, it's actually helping with community development because they're learning how to respond to each other and they feel like they're talking to each other. And then I jump in too. And I think that that's the most important thing as a student as a faculty member is to like make sure that you're jumping in as well. And that you're really modeling what the feedback should look like. At this point in the course, I really don't need to jump in that much because they've gotten really good at it. But in the beginning, you need to show them what it looks like. And the students will use that feedback process to learn what good is. So they'll see their peers and they can tell, oh, this person really phoned it in, or this person's is so good, I want to do that. And I always love seeing that. Yeah, the perfectionists struggle. They always spend, this is to Cindy, they always spend a really long time getting the artwork absolutely perfect. And one thing I'm going to add in the next round is a check-in so that I can kind of push on students that haven't been turning stuff in and just be like, it's good enough, just turn it in. Once they were allowed to revise and resubmit, it did tone down the perfectionists a little bit. Some of the students get a little too into the drawing, and that can be problematic. Oh, here's a suggestion. Use visible body, flashcards, and tours as a way for students to prepare for their presentation or sketch notes. And then the draw and annotate tools lets them personalize. So this is a really cool thing. And the great thing about those note card sets is they can send them to each other. So, or you could send one out. You could be like, here's the note card set that you have to use, and you're going to annotate it and then send it back to me. And that would be a more static way of doing the video, but it might be a little faster if you've got a really big class and you have to grade. So that would be really neat. All right. Oh, do I have traditional lectures? It depends on the class. So most of what I do for my students when I lecture, I switched to the mini video tutorials. I love doing those. A lot of my students are, their parents or their, so a lot of them, they're non-traditionals. So a lot of them are parents, a lot of them are working, and a lot of them have kids. And so they kind of need like a shorter snippet. It works really well for the students that have, like ADD as well. So I do short lectures. Embedded in the quiz are little multiple choice quizzes inside of those short lectures. And when I see my students for A&P, it's like an old school recitation. We get together and we review. And they know that. They know coming in, we're going to review it. I'm going to be asking you to fill stuff in. So it's not quite a flip, it's more of a lean. And then with my Bio 1 students, when I see them, they're asynchronous, so they get the online lectures. And usually they have stuff to do. I don't post as much lecture because I often like to give them that hands-on experience if I can. So they have stuff to do. And then when I see them in person, I'll give like a mini rundown and then we'll do something different. So they kind of get this review cycle too, where it's like, this is what you learned last time. Now let's move on. And so I like to do it that way. I can see where, at some point the student stuff could get posted, couldn't it, if they wanted it to. oh, how do I make the process equitable for students that are not tech savvy? So the big thing is tutorials, tutorials, tutorials. Since I'm already posting mini lecture videos on the content, I can post additional lecture videos on this is how you do this with this software. One of the things I did at the beginning of the pandemic was to create a series of documents to use for basically anyone who wasn't tech savvy that had to come up in a hurry and figure out Flipgrid or Kahoot or whatever it happened to be, that suddenly you had to learn how to use it. I created a bunch of like guides. And by the way, if you want those, email me. It's just cindy.harley@metrostate.edu. So the great thing about those is that I was able to kind of recycle them. And I kind of had this idea that students would be creating videos. I have created little mini videos. They're about 30 seconds of me showing them, okay, this is how you upload. And this is how you make the video. And if I really notice a student is struggling, which is usually they have not turned it in, I try to reach out and say, like, do we need to do one together? Most of the time they figure it out. My guys are they've been pretty tech savvy. The bigger problem is that they're having, I think the bigger problem is what I would call the inner hater. It's learning to deal with just that imposter syndrome that students often are dealing with. All right. Do I assign the peers? No. So the students, oh my goodness. The students get to look at the works. And what I usually will say is, I'll divide it up and I'll say, I want every work to get 2. So if it has 2, don't leave a comment on that one, skip. And the students have been pretty good about that. The nice thing about not assigning which work that they have to look at is that it comes in 2 parts. One is that the students actually get their stuff in on time. Theirs are posted first, and so they get the comments first. The second part of it is that the students can kind of pick where they feel that they need where they feel they can give the most help. So sometimes they're not clear on something and they don't want to give help on that thing that they're not clear on. But they can give help elsewhere. What I have done in the past is I've assigned specific questions that they have to address, but that was really cumbersome. I don't think any of us liked that. So I've been letting them select, but they're really good and they share the love, which is good. So they tend to spread it around, and I've explained why, and like, don't you want yours to get peer review? Okay, if you want yours to get peer review, then let's make sure everybody gets 2. I always try to make sure that I'm in there giving them feedback. Oh, can we send a copy of the recording out to you? That is a question for Emily.
I'm here. I'm sorry, I was pressing the wrong button. Absolutely, yes. We will send this recording out.
Excellent. And as said, if anyone here, I'm going to put my email address in the chat. And if you want to see more rubrics, if you have questions, feel free to bounce them off of me, or bounce ideas off of me. Feel free to ask. A lot of the comic thing and a lot of my thoughts about that actually came from meeting with instructors sort of through Visible Body. I think I had the office hours about something entirely different. And I was talking to people about different ways of assessing students, and it just came out of this organic conversation. So now I get to pay it forward, as it were. And I'd love to hear more ideas. Oh, for Gen Bio, the big adaptation is content. So there's a question about how to adapt this for Gen Bio. The big adaptation is in the content, obviously. The great thing for me is it actually focuses my lectures significantly, so they're really kind of clear and to the point. And for them, I haven't been using the dissections as much. I really focus with the Gen Bios more on the comics. But one thing that they get that the A&P set don't get is in Gen Bio, I want them to learn how to read graphs, and I want them to learn how to explain an experiment and know like what the parts of an experiment are. So that's a big part of theirs is, hey, we did a lab experiment in class. Can you explain what was in each beaker, why it was there, and what the results tell us? And so they have some much more functional stuff. And the Gen Bio students get a little more, I don't want to say holding, but they get more feedback from me. So it's, here's one from John. I love how you talk about taking notes and using comics. It's an important skill. How do you introduce them to this in what medium, paper, pencil, or online? So when I am lecturing, and I didn't do while I was talking to you guys, but I'm drawing. And so they're always seeing the drawings going up real time. And so they kind of get used to the style. And then, you know, we adapt it from that. So one thing that I do like to do, especially at the beginning when I'm introducing students to this concept and they think I've gone around the twist, is I like to give them the lecture and I like to say, okay, now that we've done this piece of it, let's try to draw it, and we'll draw it out really quick. And, you know, what are the big concepts? What do we need to put together? Where, you know, what did this lead to? Just to give them an idea of what it would look like. And usually I start by making it all words and then starting to erase the words and write in stuff. One thing I've done more recently is I did a time lapse of myself making one. And I posted the time lapse so they could see my process. And they actually see where I get intensely frustrated at some point. So with graph reading, one of the ways that I work with that, honestly, is that they have to put an arrow to the axis and tell me, like, what is each axis? What does the trend show as the relationship? And then I teach them that your title has to be the take-home message. It doesn't get to be like enzyme versus time. I already know that from the axes. I want it to be like what I should get out of it. And so one thing that I'm big on for them is teaching them, you have to write that title in and it has to be the take-home message. And the nice thing about the sketchnoting is it takes it away from the technicality. Like, I don't have to think about Excel. They do graphing Excel, but they don't have to like think about it for this. They can just draw what a trend would look like and then explain it a little bit. So yeah, this would be a fun way to talk about, like, I think any pathology, right? You could, I was looking at figure 1. And, you know, figure 1 has those wonderful case studies. You could totally post a case study and be like, you know, you can use this. You need to explain what's going on. And one way you could do it, and this is one of the sort of more equitable practices, we like to think about giving multiple ways to fulfill an assignment. I could see where a student would have the option of a comic, or you could make it like a health pamphlet. I've done that too. Or a video, or I don't know, a paper, right? You could split it up and allow them to turn in different things, just depending on what they feel would be the biggest match for them, or maybe have them do each one once, but they can pick which they do. Yeah, Elizabeth, feel free to reach out. Sabbatical is so much fun in terms of rethinking A&P. And I think that there's a lot of room there. There is a group through SABR, the Society for Advancement of Biology Research, Education Research, and they have a group called PMIG that has started these monthly seminars on A&P that are fantastic. It's all about how to teach the really hard stuff. And it's the best group of people. Yeah, there are tons of pathology models to use. I love using the microanatomy. I'm such a nerd for microanatomy. So I'm like, okay, you've got to show, like, the intestine rubric actually makes them show the microanatomy of the intestine and explain how that surface area is created and why that's important. And they have to explain the mesentery too. I was like, it's our newest organ. So now you have to explain what it does. And it's a hoot just to see what the students do. They're having fun with it. One of them names his cadavers, cracks me up every time, and works it into this whole story about what the cadaver is doing. there's some beauty to when the students bring in their experience into the scenario. Oh, Gail, I see that your hand is up. I'm sorry, I was just going through the questions. In my class, we blurt. Do you still have a comment or a question? Oh, okay, hand went down. All right. So anyways, hopefully this is food for thought. Like I said, this has been my own mental journey about exams and whether or not this is I guess I want to say a legitimate part of the learning experience, and whether or not we should think about other things for our students that may actually be more effective at getting them to do the things we want them to do. And, you know, I told my dean, I said, you know, this is a fledgling bird. It doesn't have the feathers yet and it's kind of ugly, but I think it's going to fly someday. How many other colleagues teach A&P? Are they doing some of these things? So we're a smaller program. There are currently 3 different A&P instructors, and we rotate who does what semester. So I always teach AP2. My colleague Lori, who's amazing, and she's such a bone geek, so she gets semester 1 because she gets to talk about bones and muscles, and that's her love. We kind of rotate between the 2 of us. She does a lot of unique assessment types. I think she's done some things with note cards. She hasn't done the video stuff, but a lot of that is new this year. And this was a huge experiment for me to I literally wrote my dean an email saying, you're very likely going to have a student come in complaining about me. They haven't, but I was ready for it. So, all right. Okay. Emily, I think we might be out of time.
Okay. Well, thank you so much, everybody. This has been wonderful. Thank you, Cindy. This was amazing. Appreciate everybody's thoughtful questions. If we didn't get to any, do feel free to email Cindy or just fill out any form on our website that goes straight to the education team, and we're super responsive. You'll hear from us in a day. So, thanks, everybody. Have a great rest of your afternoon.
Thank you.
Thank you. Thanks, Cindy. Bye-bye.